Post-tibial tendon dysfunction cast, commonly called PTTD. And with this cast, I think it's real important that you get a really good heel cupping on this one here. For my own benefit, whenever I'm fabricating orthotic, I like to have a nice heel cup, because sometimes you're dealing with a fat pad issue too, which we're going to do. We're going to go over that one too. But sometimes you have fat pad atrophy, and the first thing we want to do is want to be able to accommodate that by not allowing that fat pad to thin out anymore. We get a good, nice heel cup here. High heel cup is what it's called, or deep heel cup. But the way you determine how that heel cup is the way you set the foot in here. So we're going to do the left foot first, full weight bearing. Go ahead and stand up. Left foot. Okay, so you position her here, and the first thing you want to do is have her look straight forward, put her hands down to her side. This way we got a perfect balance when we get ready to lift her foot and put it in there, okay? Going to the foam box, I'm going to slide this back to the tip of her foot. Then I'm going to ask her to go ahead and raise her foot up, and I'm going to put her foot down right there in the foam box. Okay? All right. Go ahead and step down on, step down on that. You good? Notice I still have her forefoot in a dorsal flex position. All right. Getting ready to go down. Okay. Now, I'm not going to push down the middle here. I'm just going to push down the metatarsal heads. I do not want to collapse this arch any more than it already is. Okay. So I'm going to push down 1, 2, 3, and 5. Okay. That's our cast that we're going to do right there. Okay. This is post-tibial tendon dysfunction. This is full weight. It's going to be different when we do semi-weight. Okay. Go ahead and put your foot out. You come out. Okay, so that's what we got right there. Nice deep heel cup. Arch is not collapsed too much, which this arch right here, if she actually had PTTD, that this would be flattened all the way out. You'll be able to see the navicular right there. Okay, so because she doesn't have that, I'm still going to do the technique that we would normally do for full weight and non-weight. Non-weight is different. Okay, is a difficult disease because the tendons that's coming out behind the calcaneus, they are weakened. And so the bone doesn't have the strength from the tendons to actually hold the muscles and the tendons together, so they roll in. Okay, so let's do the right foot. All right, so now, because we're doing post-tibial tendon dysfunction, there's a different technique that I would use while she's sitting, because we need to be able to get the right amount of support for that arch. And we need to keep that heel cupping to support the fat pad. Okay, so go ahead and lift your foot up. And I'm going to position her heel down. Same thing we did over there, but the only difference this time is I'm going to press down on that heel, and then I'm going to roll her to the lateral side. And what I'm going to do is I'm going to push that lateral side down. Then I'm going to push 5, 4, 3, 2, 1. Notice I didn't check for neutral. I'm not checking for neutral is because I need to evaluate this arch right here and how far it's going to be going out before I even attempt to do neutral. So right now the arch looks like it's in a very good position. I could check for neutral. Check for neutral. I'm in neutral right now. And to adjust neutral, you don't have to twist the foot or anything. You can actually do it from the hallux. Push the hallux down and it'll actually give you the position that you need for neutral, okay? So right now, we have support in that arch that we wouldn't have in full weight bearing. So if you're dealing with somebody who has a very, very severe case of PTTD, this is the way you want to do it in the foam box. If it's just a normal case, well, I wouldn't call it a normal case, but if it's a balanced case, you go ahead and do a full weight bearing, okay? All right, go ahead and take your foot out of there. Notice the lateral side. The lateral from semi-weight bearing to full weight bearing. Full weight bearing is complete, all the weight put on this foot right here. But look at the non-weight bearing. The non-weight bearing has more of a lateral side. The reason for that is because most of our adjustments are going to go from the forefoot to the midfoot. Okay?